Hi, Mary. Good to see you.
Good to see you, too. Again, thank you for doing this. I really appreciate it. Can you just give me a little bit of why you got interested in hypnosis?
Sure, I'd be happy to. I'm a gastroenterologist, and I was attending one of my annual meetings last fall. And during the annual meeting, several of the presenters presented some information about the use of hypnosis for treatment of patients with functional GI disorders. So that sparked my interest, and during the breakout session, I visited with the lady who was presenting. She was a clinical psychologist, and she essentially suggested that if I wanted to learn more, that this would be a nice meeting for me to attend.
Great. So you landed here with us?
Yes.
Yeah. How's it going so far?
I've really enjoyed the meeting. I've found the group to be very welcoming and warm and receptive to questions.
How's the training going for you? What have you learned?
I think it's been really, really fascinating. First of all, the training has debunked several maybe misconceptions or myths that I had about hypnosis, even though I did do my due diligence when I went home and I read the medical literature and I reviewed all the studies, and I phone conferenced with some colleagues who treat functional GI disorders with hypnosis.
Mm-hmm.
There's still some questions in my mind about really like, well, what is this all about, and how am I going to be doing this, and what am I going to be doing to my patients? And so the whole idea of you're not doing something to them, you're more a facilitator and allowing them to help themselves gain better control over their autonomic nervous system and the brain-gut interaction really resonated with me.
Great, great. How do you think you might use this as you transition back home and back into your practice?
Well, there are several areas that I think it may be helpful in. I think it may be helpful in helping some of my patients who are undergoing endoscopic procedures feel more relaxed with maybe the use of less medication for the procedure, so I think that could be very useful. But my main goal is to really be able to use hypnotherapy in the treatment for some of my patients with functional GI disorders. And in the setting of functional GI disorders, there are actually physiologists and PhD psychologists who've developed scripts. And I know people feel both ways about scripts, but I think starting out and trying to incorporate hypnotherapy into my GI practice, I think scripts will be a good jumping off point, and I think just as far as helping me to be comfortable with the concepts and that type of thing.
Great. Thank you so much. I really appreciate it.